So first off, when we look at the stomach, we see that's where we're digesting all of our foods. And our stomach is using really strong acid in order to do that, as well as enzymes and other substances like pepsin. Now, there's a little flap that exists here between the stomach and the esophagus called your lower esophageal sphincter. And the job of that sphincter, it's kind of like a flap, right? And what it does is it keeps all the stomach acid in the stomach while you're digesting your food. Here's the issue. When that sphincter becomes weakened or damaged, the contents of the stomach start to reflux up into the esophagus, causing esophageal ulcers or esophagitis. It could also lead to problems with your teeth, where your gums start to rot away. Basically, your teeth start to rot away. You could develop sinus problems, even maybe connected to different thyroid disorders. Essentially, we don't want the acids going up into the chest, mouth, or sinus or ear area. It could even be linked to ear infections. We want to keep that stuff in the stomach. Why does this thing get weakened? Well, one of the things is when there's increased pressure in the stomach. Let's think about this. Imagine blowing the stomach up with air. The pressure from that gas or from that air pushes against that little valve, eventually popping it open. And then what occurs is the acids start to reflux up into the esophagus. So what are things that are going to increase the amount of gas in the intestinal tract that's going to affect that valve? Well, the first thing is something called SIBO, which is known as small intestinal bacterial overgrowth. This is when there's too much of our bacteria that should be in our colon in our small intestines. And when that occurs, it's basically the bacteria is in the wrong place, right? So it should be in the colon, and there's too much of it in the small intestines. As a result, that increases gas and increases the pressure on that lower esophageal sphincter, and then pop. The next one is a bacteria called H. pylori. Years ago, I was unfortunately infected by this. I had horrific heartburn. Every night before I went to bed, I drink like a gallon of water almost, just to help calm everything down. It was really nasty. So H. pylori does the same or similar thing as SIBO. It's just a different organism. Parasites, yeast, candida overgrowth can be a big culprit here. The inability to manufacture enough stomach acid, actually low stomach acid, can lead to GERD. Why is that? Well, there's actually little receptors in that lower esophageal sphincter, and they receive acid. And when the pH is low enough in the stomach, that sphincter closes and stays closed. When there's not enough acid in the stomach, that sphincter actually starts to open up, and you start to reflux up whatever you have in your belly, which is going to be some acid. There is going to be acid there. It's just not acidic enough.